Hello, it's Suzanne Alexander dialing in from Pittsburgh, Pennsylvania. I lead the Live Like Lou Foundation, and I'm actually leading it from your brother Neil's desk. Your brother Neil Alexander, my husband, was a Delt, and he lived with the disease of ALS for 1,365 days. This is a picture of our family right after his diagnosis with ALS. And so that's me kissing Neil. It's our daughter Abby, and that's our son Patrick. And Abby's kissing our dog, and that's our other little dog. So anyway, Neil was a strong guy, your brother, and he was determined to leave the disease of ALS better than he found it. And we started the grassroots effort, Live Like Lou, when he was diagnosed, and it continues today as a national foundation in partnership with the Brothers of Phi Delta Theta and in honor of our namesake, your brother Lou Gehrig. It is my total honor to work with all of you in helping to realize the vision of leaving ALS better than it finds more than 16,000 Americans every day in honor of Lou Gehrig. So here's your brother Lou. What a mighty man. And I have some other videos out there that tell the story of your brother Lou and what a tremendous inspiration and powerhouse he was even before he got the disease of ALS, when he was just the Iron Horse. And as you know, on the 4th of July in 1939, he went from being the Iron Horse to being the luckiest man. And we are so fortunate to have his example for how to go through hard things, like the 100% fatal disease of ALS. So I'm very honored to be on this journey with you for this terrible disease. So you're watching this video because you have signed up to volunteer for an ALS family in your community. Whether you're going with other brothers of Phi Delta Theta or you're going by yourself, maybe you're going with your chapter, or maybe you're bringing some family members with you. Awesome. Thank you. I wanted to make sure you heard from me a couple of things that you might expect, a couple things you definitely want to do when you visit an ALS family, a couple things you definitely don't want to do, and just some things to consider along the way. So ALS, the disease, amyotrophic lateral sclerosis, is a 100% fatal disease. It's terrible. And people who get the disease generally live 2 to 5 years. Sometimes patients will decide to get a tracheotomy, which is a breathing device, and they can live, 10, 15, 20 years sometimes with the disease, generally totally paralyzed and unable to speak. So when you get the diagnosis of ALS, it's a pretty devastating moment in anyone's life, and certainly in the life of the family and the people who love them, who go on the journey with them through the disease. We care for the caregivers as much as we care for the patients, because it takes a lot of grit, a lot of humor, a lot of muscle, a lot of determination, a lot of humility to get through this course with grace and success. So the partnership with Phi Delta Theta includes raising money, which your brothers have been doing, and it's fantastic. We've raised over $2 million for the disease, and we're spending it. But it also includes volunteering for these families in their home, because when you have a loved one in your home that can't use their arms or their legs or their voice to get things done the way they used to, things start to fall apart. You need a basement that needs cleaned out, or a tree falls and you can't clean up the mess, or maybe there was a storm that came through and there's flooding or damage, or maybe just the weeds have grown, and it starts to depress you because it's hard enough to get through the disease of ALS in your family on a daily basis, but then to look at the things that are just going undone, it starts to really be hard on the whole family. And then you guys come through, you Phi Delts, you come through and you clean up the weeds and you lay down the mulch and you chop up the wood, and you drag away the stuff that's gathered in the basement or in the backyard. This is such important work, and it matters so much. It brings so much dignity to these families. And I'm very grateful. This is the heartbeat of Live Like Lou and our partnership, and the families are grateful too. So you have received the call to go and serve a family. And when you connect with a family, first of all, they may or may not answer their email, or they may or may not answer their phone. And this is because life is hard when you have ALS. It's very hard to stay up on your to-do list and return calls and return emails. So please don't give up on them. Please keep dialing them until you make a connection and can set a date to volunteer. Once you set up the date to volunteer, make sure you have the right equipment. Make sure you've scaled the job so that it's reasonable, because especially if you're just one person, if it's more than you can reasonably do, tell them you can't do it, or tell them you need more time, or they need to get some more equipment. But if it is something you can do, definitely show up at the date and time that has been agreed upon. Make sure you're ready to go. Make sure, I know you know this, make sure you've used the restroom and you've fed yourself. You've got the gear, the protective gear. These days you've got a mask, and you are ready to do the work so that the family feels like you're there for the right reason, and you know, they're not a burden on you, and that you're ready to go. You may not meet the patient. Sometimes the patient is feeling ill, or is unable to move, or unable to greet you, or they're worried about infection. They've had to visit the doctor, or a million other reasons. They could just be having a bad day, and you may not meet the patient. And I know that that's going to be disappointing to you as the volunteer for the family, but I want to encourage you that it's really special what you're doing, and the patient and the family will know what you've done. So please feel good about what you're doing when you get there, and greet the family just like you're their next door neighbor. Bring your good humor and of course, your respect, which I know you do, and your can-do attitude. And that will make them feel really good about the fact that you're helping them. Sometimes for them, it can be hard to ask for help. It's a pride thing, right? You know, you don't want to need help. You don't want to ask for help. So the more good humor and professionalism that you bring to the interaction, the better they'll feel about it. Also, you know, the patient or the family may actually do the exact opposite, and they've got like the media there, and they're throwing a party, and they're really glad you're there, and they've invited all their neighbors and family and friends. You know, go with it, feel good about it, and feel good about the work that you're going to do for the family. Sometimes the patient will be in bed. Sometimes the patient will be in a wheelchair, which is a really big, special type of wheelchair that ALS patients use. This is your brother Neil. After his disease progressed, his wheelchair had an elevator. You can see the muscle wasting in his arm and in his neck. Sometimes they can't raise their head to speak. Sometimes, you know, they might be in different states of clothing because they can't always get dressed easily, especially if you can't use your arms and your legs. I want to encourage you, even if they can't speak clearly, to address them as their role in the home. They may still be the head of the household, even if they can't speak. They may still be the breadwinner in the home too. So you want to make sure you're using eye contact, and you're speaking slowly, and you're listening, because even though their voice isn't strong, or maybe they communicate using eye gaze device on their laptop or on another screen on their computer or their wheelchair, take a breath, take time, listen, and make sure you address them as the head of household or whatever their role is in the home. And use your humor too. Just because they can't speak doesn't mean that their sense of humor is diminished, or you know, the things that they want to say to you are less important. It just takes a little bit more time, and I promise you, you'll get a lot out of the interactions. So the other thing I want to tell you is, if you're volunteering for Live Like Lou, we're going to send you an Onward shirt. Make sure we get a picture of your event. If you can send us a picture, if it's okay with the family, and we'll send you this shirt. And I think you probably know by now, this is the words that your brother Neil used when he was trying to rally the rest of us to leave ALS better than he found it, than we found it. And then there's the logo on the sleeve, which is the Live Like Lou logo. The lady who designed this shirt tried to find a font that most closely matched your brother Lou's autograph. And so she put it together. I can't unfold it, but she put it together in a way that was very respectful of your brother Lou and the legacy that he left, in our desire to live like him, to feel lucky and to feel a sense of pride in all that we do for the cause of ALS. So when you get your shirt, I hope you wear it in good health and with the knowledge that you guys are doing some amazing work for the cause of ALS. So thank you for doing what you're going to do. Give me a call if I can help, 412-390-8435. Send pictures of your event, and feel good about all that you're doing for the cause of ALS. It really, really matters. So thank you. Take care. I can't wait to see your pictures. Bye.